Good morning, everyone. This is Shanza Hussain. Today, I am starting with the topic thyroid function test. Here, I want to thank my dear friend Shagufta Siddiqui for this brilliant slide. So, here I start. Introduction. Thyroid function tests are a series of blood tests used to measure how well your thyroid gland is working. Here in the picture, you can see the thyroid gland. What is thyroid? Thyroid is a 2-inch long butterfly shaped gland. Here in this picture you can see it is a 2-inch long butterfly shaped gland. Location located in the front of the neck below the larynx or voice box. The thyroid job is to make thyroid hormone which are secreted into the blood and then carried to every tissue in the body. So that is what thyroid does. Now what is the function? Thyroid hormones, they regulate metabolism in a way the body uses energy. Thyroid hormones also affect brain development, breathing, heart, and nervous system function, body temperature, skin dryness, etc. So these are extra functions of thyroid hormone. Next, we have what kind of hormones thyroid makes. So, thyroid makes two types of hormones, that is thyroxine and triiodothyronine. Thyroxine is called T4 in short, and triiodothyronine is called T3 in short. Here, secretion of thyroid hormone, the iodine is essential for formation of thyroid because in T4 there are 4 molecules of iodine and in T3 there are 3 molecules of iodine. Here we have a fact that can be matlab interesting fact is that T3 is the more active form of T4 which works and helps in metabolism. So that was all about thyroid hormones secreted by the thyroid gland. Now we have thyroid stimulating hormone. It is secreted by pituitary gland. Pituitary gland is present in the brain. Here the role is it regulates production of T3 and T4 by the thyroid gland. The normal range is 0.4 to 4.0 milliliter ml miu per liter. I will confirm the units again and comment it on the comment section, so don't worry about the unit and normal ranges of these hormones. So what does it indicate? So basically thyroid stimulating hormone is secreted by the master gland, that is pituitary gland, which tells the thyroid hormone to secrete more T3, T4 and T3. High TSH indicates hypothyroidism and low TSH indicates hyperthyroidism or pituitary dysfunction. So how can we justify this fact? So if thyroid stimulating hormone is high, that means thyroid gland is not producing T4 and T3 as required by the body. So it indicates that the thyroid is hypothyroidism condition. Now if the thyroid stimulating hormone is low, that means T3 and T4 is already present in the body, so that can indicate hyperthyroidism and also pituitary dysfunction. Next is the test. There are two types of tests, that is total T4 and free T4 and total T3 and free T3s. Here we have defined free T3 and free T4 because that is the main test that defines or tells about the conditions. So the role is major hormone secreted by the thyroid. thyroxine, that is T4, is the major hormone secreted by the thyroid function. We already know it maintains metabolism and energy levels. Now normal range 0.8 to 2 nanogram per deciliter. High free T4 suggests hyperthyroidism, and low free T4 suggests hypothyroidism. Now, free T3 triiodothyronine role, active form of thyroid hormone, function regulates metabolic activity at the cellular level. Normal range 2.3 to 4.1 picogram per ml. I will give the normal range all in one unit, so don't worry about this normal range. High free T3 indicates hyperthyroidism, low free T3 indicates hypothyroidism or conversion issues. Anti-thyroid antibody tests. So these are few tests that are used when thyroid disorders are autoimmune disorders. Autoimmune disorders are those that happen to attack their own cells. So thyroid peroxidase antibodies, that is one type of test. Thyroglobulin antibodies, that is TG antibodies. TSH receptor antibodies. So these tests are main purpose is Hashimoto's and Graves disease detection. Okay, and these disorders mostly are present due to some or the other reason. Presence indicates immune system attacking thyroid tissue. I have already told that it is autoimmune thyroid disorder. Okay, next we have other common thyroid disorders, which are hypothyroidism and hyperthyroidism. In hypothyroidism, which is written in yellow, and hypothyroidism is written in bluish color box. So hypothyroidism is symptoms are fatigue, weight gain, cold intolerance, hair thinning, and causes, main cause can be Hashimoto's thyroiditis and iodine deficiency. Hyperthyroidism can be, symptoms are weight loss, heat intolerance, rapid heartbeat, and the causes are Graves disease, toxic adenoma. So toxic adenoma, I will explain it in another slide, in another video. So Hashimoto disease and Graves disease is also a major topic for another video, but here we can see that Hashimoto's and Graves disease are main causes of hypo and hypothyroidism respectively. Common conditions and treatment. Hypothyroidism, we already know, we already have seen all that. TFT findings we have seen. Now what can be the treatment? The basic and most common treatment is levothyroxine or T4 replacement. So dose is adjusted based on TSH levels and symptoms. Regular monitoring of TSH level is essential to ensure the correct dosage. Okay, so that is how we treat hypothyroidism. Now we have hyperthyroidism or overactive thyroid. So we already know the TFT findings. Treatment can be anti-thyroid medications like methimazole, propyl thiouracil PTU, radioactive iodine therapy RAI, that destroy thyroid cells to reduce hormone productions. Then beta blockers to manage symptoms like rapid heartbeat, that is tachycardia. Surgery, that is thyroidectomy, may be recommended in the severe cases. So that is the treatment, from oral treatment to the surgery, everything is given here in a short form. Monitoring and follow up. Regular follow up with TFTs is crucial. Why? Because medication effectiveness will be ensured, then doses can be adjusted, and any complications can be prevented. Always consult with an endocrinologist for personalized treatment based on TFT results and clinical symptoms. Now, the last part is thyroid function tests are critical for diagnosing and managing thyroid disorder. Proper interpretation of test result ensures accurate treatment. Regular monitoring is key to maintaining thyroid health. So we can also manage thyroid with the help of non pharmacological management, and we can also manage. Also, one fun fact I want to tell you, that radioactive iodine, they are talking about the iodine isotope I-131 that is used in imaging and diagnosis and treatment of thyroid cancer and thyroid cancer cells, and it is not prevalent in India just now, but it is used in developed countries. So that was all about thyroid gland. Thank you. See you next time.